Hello, good evening, everyone. Since I would have last been on the press briefing, I am here now to allow you to know that home isolation is in its second wave, as we're all aware, with Omicron. And we continue to have a pattern of predominantly well persons in home isolation. We have a maximum at this point in time based on our dashboard 9,575 persons in the home isolation program, with over 3,426 of them being green. Since the commencement of the Omicron wave, our program has also changed a bit in terms of persons who are allowed to stay at home. Dr. George would have spoken in terms of a self-isolation component, and we are happy to say that this part of the program has been going quite seamlessly, and we continue to ask that if persons at any point in time should develop symptoms as they have and they're concerned about, to please contact our call center or our operations center to gain care. Since this Omicron wave has started, the pattern for COVID has somewhat changed in terms of symptoms that patients may present with. We have seen persons with increased cases of vomiting and diarrhea for this particular wave. And so at this point in time, I would encourage persons that if at any point in time during their illness or the course of their illness, that they ensure to remain hydrated. How do you do that? In medicine, we usually say slow and steady wins the race. Quite often we think that if we have a large vomitus or a very large watery bowel movement, and we don't always feel like eating or drinking, that we just stay away from fluids. Or if we are going to take in fluids, that we need to do a very large amount in a short space of time. What I'm saying to you is take it nice and slow, small volumes of fluid to ensure that you do not become dehydrated. Also, during this period, we have had the greatest number of discharges for the program, and we continue to work quite valiantly. Our team is actually working around the clock 24 hours to ensure that persons are discharged in as timely a fashion as physically possible. However, if at any point in time you should develop symptoms in keeping with shortness of breath, feeling extremely weak and tired, having any episodes where the family members have noticed that you've lost consciousness or you have fainted, please certainly reach out for assistance. The Omicron wave has demonstrated that for the majority of persons, especially those who are vaccinated, that this course can be quite mild. However, given the background predominance of our NCDs, I also want to encourage the Barbadian public to pay attention to your non-COVID health. Monitoring your blood pressure, monitoring your blood sugars, and certainly eating better than ever before and sensibly is of utmost importance at this point in time. We also know that we have continued to have very minimal cases, although from a clinical standpoint, we consider it a lot. We have 8 deaths within our home isolation program, and in our opinion, that is 8 too much. And we would like to continue to keep our deaths within community as low as possible. Certainly, we will continue to provide care and access to care as much as we can. And we are happy to be moving in the direction of an assessment center that is dedicated for persons who are either COVID indeterminate. So you may have been in a household with someone and that person is positive. You are now displaying symptoms, but you do not have a confirmed PCR test. The assessment center that Dr. George would have spoken to is certainly of utmost importance because it allows a dedicated space for you to be assessed and managed as you are made aware of your COVID status. Also, I want to encourage persons that if they should at any point in time perform a rapid PCR test, whether at home or with any facility especially if you have been symptomatic, to please follow up with a PCR test as soon as possible, because that is important in terms of us being able to monitor and fast track you through our system. And I really want to urge persons to continue to test as they are. I am happy to state that our refusal rate is at an all-time low. And this is the refusal of transport. And the last time that I came on the actual press briefing, I would have asked persons to really reconsider not refusing care. On our dashboard, we only have 80 persons who have refused care, especially during a very large Omicron wave. And I think that that is extremely commendable. It speaks to the importance that, as the Barbadian public is now aware, that this is not just a normal flu, but certainly it's not something for us to panic about. And also that our isolation facilities are there to provide you with the care that you need, and they do so quite competently. So at this point in time, I am going to stop and pass it back over to Dr. George or Lisa.